I was diagnosed with bladder cancer in early 2023 when at the time I was 65, and I had a number of tests. The scan showed up a tumour, a grade 2 tumour, but quite a big one. And about 2 months after that, this would have been in April 23, I had an operation to remove the tumour. I kind of became, resigned to what I had to go through, because the alternative was, nothing. It was, it was you're gone, and you don't want that. The sequence of events that followed removing the cancer were quite complicated. I had some problems urinating, and then they got better. You leave the hospital, if you've got a catheter, you go back 2 weeks later and you do a test called a TWOC test. And I did that, and I could urinate, but not at huge volumes. But I made the decision myself, because technically I hadn't urinated enough, that I wanted to leave without a catheter. And I then found myself urinating very frequently. I also ended up getting UTIs. I had to go back to hospital for that. So I had all sorts of problems around urination. I was living without a catheter, and I was kind of almost living a normal life, but the peeing was too frequent. And this then led on to further complications. In a nutshell, my bladder ended up being in quite a difficult shape, and that was impeding my urination. And in the end, the doctors felt they had to take it out. So that operation happened 7 months ago, and I'm tested because in the histology, when they looked at what was in the bladder after the operation, there was no cancer. There was a bit in the prostate, but not, they told me, in a dangerous area. But I do get tested with blood tests, my PSA levels, which currently are 0. So at the moment, I've got a urostomy bag, which I've got used to. Nobody wants one, but you do get used to them. And I haven't got cancer. I put weight back on. I lost a lot of weight after my operations. It's an 8-hour operation, so it's quite big. And I'm looking forward to the rest of my life. Most people are a lot more resilient than they think they are, and you get used to where you are in life. And there's nothing you can do to turn that back. You've got to have the operation, and you've got to go through all the recovery things, because there is no alternative to it. When I was first diagnosed, if they said, "Oh, on the end of this, you're going to be wearing a urostomy bag," I would have been appalled. I would have just thought, that's the end of it. Take me away. I don't want it anymore. But by the time I got to that, I was just used to everything happening, and I realised it was the best solution to the situation I was in. I was in an unfortunate situation. That was a solution to it, and I'm living with that solution, and the solution's pretty good. Anyone looking into the outside would think I was leading a normal life. Went out to dinner last night. We're going to go to a football game on Saturday. It's not, I'm seeing friends, I haven't got a terrible life. It's a good life.